Hello everyone. Today we are going to study about the common recruitment examination or commonly known as CRE for the recruitment of physiotherapist in AIIMS All India Institute of Medical Science all over the India. Along with that, we'll also study about the multiple choice questions of CBT or computer based test or CBT for physiotherapist recruitment in various state government hospitals. Okay, in this, firstly, we'll we'll study only the MCQ questions. MCQ, study about the MCQ questions. Number one, today we'll largely focus on the anatomy part. Okay, we'll focus on the anatomy part. Number one, the gastrocnemius muscle is supplied by which nerve? Number one MCQ questions. The gastrocnemius muscle is supplied by which nerve? Number A option is femoral nerve. Number B is obturator nerve. Number C common peroneal nerve, and number D is tibial nerve. So gastrocnemius muscle is supplied by which of the following nerve? Number one is femoral nerve, number B is obturator nerve, common peroneal nerve, and the tibial nerve. Here is the answer. Answer will be the number D option, tibial nerve. Number D option. The tibial nerve, why the tibial nerve, which is a branch of sciatic nerve. The tibial nerve is the branch of sciatic nerve. The tibial nerve innervates the gastrocnemius comma popliteus soleus and plantaris muscle. Okay, the tibial nerve innervates as the gastrocnemius, popliteus, soleus, and the plantaris muscle. These are all innervates by the tibial nerve. The in this perspective, we will also know the sural nerve, which is a cutaneous branch of tibial nerve. But which also receives innervation from peroneal nerve. Okay, the number one question was the gastrocnemius muscle supplied by which of the following nerve? Femoral nerve, obturator nerve, common peroneal nerve, or the tibial nerve? The answer will be the tibial nerve. Number D option, tibial nerve, which is a branch of the sciatic nerve. The tibial nerve innervates the following muscles just like gastrocnemius, popliteus, soleus, and the plantaris muscle. The sural nerve is a cutaneous branch of the tibial nerve, which also receives innervation from the peroneal nerve also. Okay, next we'll go to the second questions. Which nerve root will most likely be affected by a posterior L3 L4 herniated disc? Which nerve root will mostly likely be affected by a posterior L3 L4 herniated disc? Option will be the number A L2, number B L3, number C L4, number D L5. Answer will be the number C option, which is the L4 nerve root. Why L4? Here the posterior herniation commonly miss the nerve in the foramen and instead tends to affect the nerve one level distal. See, the posterior herniation commonly means the nerve in the foramen, okay, and instead tends to affect the nerve one which is distal one. In case of this is L3, L4, the distal nerve is the L3 part, okay. So here it will tend to affect the L4 nerve. Why this is? Because this is because the root from the level below are located more laterally before existing before ex- exiting the canal, making them more vulnerable to impingement. Okay. Next number 3, question number 3, which meniscus is O-shaped in the knee? Number A option, medial meniscus. Number B, anterior meniscus. Number C, lateral meniscus. And number D, posterior meniscus. The answer is option number C, the lateral meniscus. Why? The lateral meniscus is larger than the medial meniscus, which is of like a C-shaped, resembled as O-shaped in the knee. Okay, and in other word we can say there are no structure named as anterior or posterior meniscus. Okay, next we'll go to the number 4. The radial head articulates with the which part of the humerus? Number A, trochlea. Number B, capitulum. Number C, lateral epicondyle. Number D, coronoid process. Yet the answer is option number B, the capitulum. The distal humerus has two surfaces of articulation. One is capitulum and other is trochlea. The radial head, here is the question, is the radial head articulates with the capitulum and the ulna articulates with the trochlea. Okay, so here are the number 4 question. The answer is the capitulum. Next is number 5. Sensory innervation to the area of skin over the middle dermatome is subserved by afferent fibers from which dorsal nerve root. Number A is C5, number B option C6, C option C7, number D C8. Here the answer will be option C, C7. Why? The C7 dermatome supplies sensation to the area of skin over the middle finger, whereas the C6 dermatome supplies sensation to first digit and whereas the C8 dermatome supplies fifth digit, the C8 one. This middle finger C6 supplies the sensation of the first digit, fifth digit, middle, whereas the C5 region dermatome supplies the lateral aspect of arm. Okay.